number of days a week having to come in is impossible. They're only open. You have to be there by 1. But so we see a doctor every 60 days. I think that coming up on your dose needs to happen faster. Especially with fentanyl and xylazine and everything that's in the dope now. 30 milligrams is not going to do it for me. So I'm going to continue to get high until my dose comes up, which is going to take about 60 to 90 days to get to a dose. And by then, my lifestyle now consists of coming to the clinic 6 days a week and then going to the hood and getting right. I think that they should be optional. So I've been there a long time now. I'm group exempt, but I still go to groups because it can be beneficial. It's nice talking to somebody else that knows what I know, that has had a lot of the same struggles I've had. But when I had to go, I didn't want to go, and I didn't care to hear what you had to say to me.
So I work actually in a methadone clinic, and our clients actually have to wait years to get take-homes, and I think that is really wrong. I think legally we're allowed to give up to 28 days, but we only give 13 days, and that's if the client is in treatment for 3 years and has 2 years of completely negative urinary dialysis. This is the only job I ever had where my job is to put myself out of a job. I think that there absolutely should be pharmacy dosing. I think that people should be able to get their medication and take it home with them. I actually was on the medication myself at the clinic I work at for 2 years. So I never got take-homes. I never had the smoke pot at the time. As far as the counseling piece, I feel like I do more case management than anything. I don't even know that I see people for a half hour a month. How effective and how much can I really counsel someone in a half hour a month? I think it's dehumanizing to watch people dose. I have to take... People have their take-home, they come back, and I have to randomly call them. And it's almost like I have to try to catch them doing something wrong. I just feel like we have to do all of these things, but for what? Are we trying to prove that someone's doing something wrong, or are we trying to help these people? It's degrading. So I don't know, I guess if it was up to me, I don't think there should be observed dosing.
Over the past 2 decades, numerous policies have been implemented to tackle the opioid crisis. Despite these efforts, the crisis persists, wreaking havoc on individuals, families, and communities across the United States. Moreover, individuals with substance use disorders, especially those using opioids, continue to die at alarming rates. While I understand the complexity of this issue and the various barriers to seeking help, what truly frustrates me is our fixation on questioning why individuals with opioid use disorder don't seek treatment. Instead, we should be examining how we've allowed such a dysfunctional and dehumanizing delivery system to persist. This is why I'm drawn to addiction psychiatry. Over the past few years, I've been fortunate to learn from leaders in the field, individuals who've written the books I've studied on managing substance use disorders, and whose work has influenced clinical practice guidelines. I've gained hands-on experience in providing care to people who use drugs, and have witnessed firsthand the effectiveness of medication treatment. But what's the point of acquiring all this knowledge and experience if I can't put it into practice? Methadone treatment plays a critical role in addressing this crisis. While medications alone won't solve the opioid crisis, they offer the most effective approach available and are proven to reduce overdose deaths. Unfortunately, methadone faces the strictest regulations among the 3 medication treatments for opioid use disorder. These barriers not only impede providers like myself from delivering effective care, but also restrict my patients' access to evidence-based and potentially life-saving treatments. This is unacceptable, and we need to strive for better by prioritizing the lived experiences of individuals who use opioids, speaking out against unjust systems that cause harm, and pushing for real policy change. Why? Because my patients are dying.
Hi, ASAM. My name is Zoe Adams, and I'm currently a second-year internal medicine resident at Mass General Hospital. After I graduate from residency, I plan to pursue a fellowship in addiction medicine and be an addiction doctor long-term. I got involved in this work when I rotated through a methadone clinic that was attached to a primary care office in New Haven, Connecticut, when I was in medical school. And I really connected with the patients I worked with there and began to realize how fraught and complex the landscape of addiction treatment in the US has been for hundreds of years. And when I stepped foot in a methadone clinic for the first time, I immediately felt that history in the physical space itself. I felt that people with addiction have been viewed as criminals and not patients for years, and how that type of stigma and that type of historical legacy continues to inform every single aspect of how we provide care for patients. Not only informing the care we provide, but all of the laws and regulations surrounding medications for opioid use disorder like methadone and buprenorphine. And when you think about statistics, like in 2021, only 1 in 5 people with a diagnosis of opioid use disorder were on one of the 3 FDA-approved medications. It becomes really clear once you're in a physical space like a methadone clinic itself, right? And just that these treatments are so difficult to access, they're so bound up, so few doctors understand the medications and how to prescribe them. The field has been so siloed. And I really want to join a new generation of young physicians who really focus on advocacy as a big part of their career, who want to try to address the social and legal aspects of this field of addiction medicine, and really want to integrate the field into just general medical care for all patients. And so that's what I hope to do. Thanks.
I attended the Liberate Methadone conference in New York in September of 2023. And it was one of the best conferences I'd ever attended. I learned so much stuff. I came out better at my job. I think so often I attend a medical conference and I actually don't get much out of it, but not this one. Hearing patient stories, hearing from researchers and physicians from around North America really shifted my thinking, and it changed how I practice as a doctor that runs clinics. I think we need to do it every single year, and I think more and more of us, particularly those of us that work in the OTP space, need to be in attendance, and we need to sit and we need to listen. My name's Ruth Pote, and I'm a addiction doctor, and I run 5 methadone clinics in Western Massachusetts, including one at a county jail. Thanks.
I think the beginnings of a new community, was born. I think a lot of bridges were made, and I think a lot of connections, and I think a lot of positive goodwill is coming from it, and I think it's giving people confidence and hope to feel bolder about making change around methadone and helping people live better lives. And I feel like the other thing that's exciting about this is not the end of the conversation, but we know that this is an important start. And I think as people come together, they feel more comfortable asking for being more confident about the steps they want to take, and I think this community is going to be a foundation for important change.
Every single day around this country, I listen to people who use drugs, and you can come to me personally and tell me what's going on, and I will do my best to try to, to fix the problem. But working with all of you, the policy, there's blood on people's hands. Yes! And there's 111,000 people died in the last 12 months. It's not okay. And those are people whose names we've just spoken, people taken far too soon. Far too soon. Every overdose death is preventable. Woo! And we can't take it anymore. And so I'm here on behalf of all of these wonderful people in healthcare who are pissed too, and we're ready to stand with you. We need to do civil disobedience. We need to get arrested. We need to throw blood on these politicians' hands, on their steps, because we're mad, and we need to, it's unacceptable. And so that we have to do better. Listen to people who use drugs, pay them, love them, take care of them, because I do not want to wake up and find more and more friends, have dead. in Maryland lost 4 people this week, and the tragedy, we can't take it anymore. Like, our hearts are breaking. So I'm so thankful for all of you and community, and we will keep fighting.